What's in this bottle is something of a medical miracle.
This has been the Holy Grail.
A medicine designed for each patient individually that may be the first important step in curing cancer.
From a science standpoint, it's incredibly clever.
But wait until you see the cost and who's paying it. That's later in the Buckley Report. A new medicine that shows promise and costs more than almost any of us make in a year.
I mean, these numbers are mind-boggling.
The government just approved its use.
Value is a much more complicated thing than cost.
Without ever looking at what it costs.
The current process that Medicare has in place is not really set up to do that.
How science can break the bank, next in the Buckley Report.
Well, how much is your life worth? Would you spend an extra $100,000 to live a few more months?
Well, the government's willing to do just that for some cancer patients. So tonight, the Buckley Report asks, what could make a medicine cost so much? Who's going to get it and who is not?
This is the heart area, and this is abnormal uptake.
Bernard Chinnasami is an oncologist who has waited most of his professional career to see a medicine like Provenge.
This has been the Holy Grail. How do we find something that's so specific to you, a designer drug that will give you such little toxicity?
Provenge is a new way of attacking prostate cancer that uses the patient's DNA profile.
It's a custom-made drug, so you take the patient's own cells to make an immune-fighting, an immune response. And so it's not a drug that's mass-produced, it's made for each patient.
From a science standpoint, it's incredibly clever. From an economics path, it's disastrous.
Medicine is expensive, and it turns out medical miracles are incredibly expensive. Provenge is one of those, if you consider 4 months more of life a miracle. That's how long, on average, a treatment of Provenge can give you. But as Wake Forest University bioethicist Anna Iltis points out,
but if you're in the position of living an extra 4 months, you say, how can you put a price on life?
Provenge's creator, Dendrian, has, and it's $93,000 for each treatment. Did you catch that? $93,000 for a single treatment. Now, you might think that with Medicare and Medicaid blowing a hole, not just in the federal budget, but the budget of just about every state, that the government might take a pass on a medicine with that kind of price. But not only did Medicare approve the use of Provenge, but they never even looked at its price, because they're not allowed to.
The government has never considered price when they agree to treatments. Actually, Medicare is prohibited from talking about costs for these type of things.
The mandate is to look at the drug and essentially ask, does it do what it says it's going to do for the Medicare population? And if the answer is yes, then they cover it.
And I think it's almost like separation of church and state, the way the government decides to do this. And in today's day and time, that's no longer acceptable.
At least that's been the message of the Tea Party movement, that Washington has to end what the Tea Party sees as Alice in Wonderland accounting, which gives people all the health care they want or need and worry about the costs later.
As a society, we have to look around and recognize that nobody gives everything to everyone. It's impossible. We have to be very realistic and upfront about numbers. So one of the biggest difficulties is it's very difficult to get a straight answer about how much something costs.
The patients who get the $93,000 Provenge treatment will likely never see that bill, but the rest of us will eventually.
The numbers kept coming down.
But Dr. Chinnasami believes that breakthroughs like Provenge open the door to a medical promise that will pay off down the road. Bob Buckley, Fox 8 News.
What often happens when drug breakthroughs like Provenge appear, though, is advocates of other cancers ask that Medicare or Medicaid pay for its use on their diseases. That is not only expensive, but in several recent cases, drugs developed for one type of cancer ended up doing more harm than good when used for cancers on which they had not been studied.